Hi, I'm Dr. Balu, a consultant psychiatrist in Kensington and Chelsea, London, United Kingdom. I look after patients suffering from common mental health problems like anxiety and depression. I'm delighted to share my experience in working with people suffering from mental illness and their families. I often advise close family members or friends who support someone with mental health problems, and I'm always learning from them about their unique challenges they face on a day-to-day basis. In this video, I would like to share my experience on some of the challenges in caring for or living with family members suffering from a mental health problem. I shall also discuss some practical tips to love and live with a close family member who may not be mentally well. We know that mental health issues can be very common and it can affect anyone. It is difficult to be diagnosed with a serious mental illness such as schizophrenia, bipolar disorder, panic disorder, obsessive compulsive disorder, and major depressive disorder. It can be equally, if not more difficult, to care for a loved one who is experiencing one of these diseases. When a person is living with a serious mental illness, the whole family may be affected. We usually come across three types of common scenarios. The first one is when a child is diagnosed with an emotional or behavioral problem. Serious mental illness in children often have a biological component. There can be birth injuries, genetic issues, or hormonal irregularities. They are not the result of bad parenting, and they probably could not have been prevented by anything that you as a parent might have done differently. Even still, after the diagnosis, it's normal to feel a range of powerful and often unpleasant emotions. It's not abnormal to feel ashamed, hurt, or embarrassed by a child whose behavior can be difficult to understand and manage. Many parents also feel anger at the circumstances and even sometimes at the child who has been diagnosed. And though it may not be logical, parents often engage in some degree of self-blame. Such feelings of shame and anger may also go hand in hand with feelings of guilt. Grief is also common. Parents in particular often have to readjust their hopes or expectations for the future when their child develops a serious mental illness. In the process, you may grieve for the future that you thought your child would have. These feelings, though difficult, are totally normal. Just as it is important to maintain your own health as you care for your loved one with mental illness, it's also important to preserve relationship with other family members, including your partner. If you have a child with a serious mental illness, you may find yourself focusing less attention on your other children. Healthy siblings may feel anxiety and frustration at the extra responsibilities they are expected to take on. Try to regularly set aside a little one-to-one time with your other children. Tell them how much you appreciate their help. Clear, honest communication is crucial for all family members. For example, don't be afraid to ask both your ill and healthy children how they feel about the changes to their family. Keeping a line of communication open will help things go more smoothly, both at the time of new diagnosis and well into the future. The second scenario is when a spouse or a partner is diagnosed with a mental health problem. Relationships, as we know, can be wonderful but challenging under the best of circumstances. When one partner has a serious mental illness, the situation can become even more complex. Many times, the partner without the disorder will assume more responsibilities, at least for the short term. For a person who is already worried about what's happening with his or her partner, having to spend more time maintaining the household or taking care of the children can be especially hard. It's important for the couple to keep in mind that most people diagnosed with a serious mental illness improve over time, and that a partner's attitude and behavior can make an important contribution to recovery. It helps to maintain an accepting and positive attitude while holding realistic expectation for the partner with serious mental illness. Participating in specialized family therapy for serious mental illnesses can be very useful. The third scenario is when you care for your parent who has a mental health problem. You may be living with or caring for parents who develop anxiety, depression, or dementia. Elderly parents often present with a complex set of physical health problems which can complicate their mental health issues. They may need comprehensive case management, often coordinating the efforts of a number of professionals working together. Irrespective of the nature of the scenario, if you support someone with a mental illness, you may face several practical and emotional problems from time to time. I would like to share some tips and suggestions to help you support someone from my years of experience working with families who cared for a loved one with mental health problem. It is very important to recognize that there is no one-size-fits-all model for supporting someone with a mental illness. How you care for someone will depend on how you and the other person you care for. It can help to understand the diagnosis and how it affects the person you care for. Setting out roles and responsibilities together can be useful. Be patient. Getting better can take time. The person you care for may have very challenging and complex behavior. This can cause a lot of stress between you and the person you are caring for. There will be help available, so please do not hesitate to ask for help from your local healthcare provider. Encourage the patient you're supporting to be independent and take part in everyday activities. If you're living together, set out house rules that can help. Make a crisis or emergency plan. Have a list of numbers to call during emergency. Remember that you're not to blame if things get difficult. Make sure you look after yourself and your own well-being. When you discover a loved one is ill, it's often hard to focus your attention on anything else. But it's important to take care of your own needs. Try to eat healthy meals, get some exercise, and get enough sleep. Making time to do the things that you enjoy will help you keep your stress levels in check. You'll be better able to support your loved one if you take steps to maintain your own physical and mental health. Serious mental illness often present logistical challenges as well as emotional ones. Your family member may not be able to work, at least temporarily. You may need to help your loved one locate affordable housing, secure transportation to and from appointments, or figure out how to pay for and pick up medication. Ask your relative's doctor and mental health professionals if they know of any social services available in your community that may be able to help with these type of day-to-day activities. When possible, reach out to other friends and family members to help ease your responsibilities. You will be surprised how happy they are to lend a hand if you let them. It's normal for the family dynamic to change when one family member is diagnosed with a serious mental illness. It will probably take some time to accept those changes and establish a new routine. It helps to remember that people with serious mental illness can live rich, fulfilling lives, and so can you. Now, let's look at some specific techniques that you could use in communicating with someone who is mentally unwell. Understanding how you provide support for someone who is suffering from a mental illness can be overwhelming and emotionally exhausting. We live in a society where empathy is often expressed competitively. We can feel bad for a person as long as their circumstances are the worst we have heard, and we can appreciate a struggle as long as we didn't easily overcome something similar. In reality, empathy and validation weren't designed to work that way. Empathy sounds more like, I don't know how to help you, but I'm sorry you're hurting. And less like, I know you're having a hard time, but it could be worse. At least you have a roof over your head. When we empathize with the people in our lives without needing to hold their circumstances up against ours or anybody else's, We'll lessen the chance that our loved ones feel alone in their pain, and we'll strengthen the chance that they'll be vulnerable enough to reach out to us in their times of need. Validation is simply the acknowledgement that a person has a feeling, even if we don't agree that it's an appropriate feeling to have, or the response we would have in similar circumstances. Validation sounds like, I understand that you're angry right now, that must be difficult. Allowing our loved ones to see what we acknowledge, what they are feeling, can give them freedom to accept that feeling and move on. If your child, spouse, brother or sister was having an asthma attack, for instance, and your help consisted of saying things like, try harder at breathing, it wouldn't work. It would be unsafe, actually. And yet, when it comes to matters of the brain and mind, we have adapted a sentiment that willpower and trying harder will get us through. Please accept that this is a flawed logic, and your loved one's mind is valuable and vital to controlling their ability to get well. What do we do when someone is having an asthma attack? We act fast. We supply them with medication when needed. We give them adequate time and treatment and room to breathe, and we treat them with respect, teach them skills, and properly take care of themselves in their critical condition. Mental illness are not very different, and they need to be treated in the same way as physical illness, so that the person suffering can achieve emotional wellness. Each mental illness, like all illness, has its own specific set of symptoms that manifest in heightened seasons of struggle. And an important part of being supportive is understanding how these symptoms affect our loved ones. For instance, a person with anxiety disorder may have difficulty concentrating or feeling fatigued and restless. Those things may seem to be leading to irritable and agitation. Someone with post-traumatic stress disorder may have a hard time staying in present or have negative changes in their current belief systems. They may feel confused, be afraid by flashbacks and memory loss. No matter the symptom, it is as uncontrollable as sweating and shaking during a diabetic crisis or throwing up during a flu. When we decide to view these things as choices and take offense, that can lead to further feelings of isolation and shame for our loved ones who are already feeling the guilt and confusion and embarrassment because of the nature of their illness. It can be very hard and lonely to be the person suffering these symptoms. It can feel like a personal attack, and those feelings can understandably get in the way of compassion. Hence, it is just as important for family members and spouses to have a network of support as it is for the person suffering with the illness. Once we have faced the reality that our loved one with, for example, major depression cannot get out of bed because it's a symptom of their illness, and not because she doesn't love us anymore or because she isn't trying hard enough to find the joy in small things, we can go to bedside and say, I'm sorry that you're having a hard day, I love you. And when we can further help by sharing our thoughts on treatment, because we've already established that atmosphere of healing and trust, empathy and acceptance. There are a number of treatment options for patients suffering with mental illness, like medication, individual talk treatment, group therapy, and specific therapy is designed to build or rebuild skills for whatever reason may have lost or we have never had the opportunity to develop. For example, emotional regulation or behavioral interventions. There can be tremendous success for people who find the right match and method of treatment, who are willing to do the work. It just takes some support, and also it takes time. Resolve to love and respect the person in your life through each part of the process, when they move forward and when they regress, when they have victories, when they stumble back into their old coping mechanisms. Isolation can feel comfortable for someone suffering with certain mental illness, and sometimes not talking is easier than trying to express thoughts and feelings that they themselves can't piece together and understand. Sometimes a person feels toxic to their environment, and they will pull away to protect people that they are hurting because the symptoms of the illness are out of their control. This is when love becomes a choice, because it can be confusing and angering time for everyone involved. Choosing to love someone who acts or feels unlovable can be a part of what helps them see that they are valued as a whole person and they are not a sum total of their pain. Seeing people we love in pain is hard, especially when we can't relate to their struggle. We may want to fix their problem and be their support system, but the truth is that no one person can fix another. No one person can alone support the weight of their own burdens and somebody else's. The best thing we can do to help the people we love is to build community around ourselves and them. People with mental illness can greatly benefit from knowing that they are not alone in their daily struggles, in their ups and downs, and having a healthy system of support in place can give them access to new ways of coping and brainstorming, as well as emotional validation that can breathe hope into their most desperate moments. Similarly, when the person you love is struggling with mental illness, you also need the support of your community. People with mental illness are not suddenly different people because they are sick. When they are struggling, they aren't monsters. When they get better, they are not new people. But our feelings and our situations can trick us into thinking so. Mental illness are illnesses. And sometimes they can change someone's circumstances. They can even change their personalities for some time, change their interest and their spirit. But they are the same person you've always loved, and they need you to see that person in them even when they can't see themselves clearly. Please share your comments and experiences with me by contacting me at www.drbalu.com. Thank you for listening.